I'm going to pass things over to Rob to wrap us up for the day. And again, thank you all for sticking with us.
Yes, okay. So thank you for sticking around so long. I know taking a full day out of your, this is hard, and I'm between you and the door, and it's a position I do not like to be in, and I take that job seriously, like, okay, let's wrap it up. Right, let's wrap this up. So this will not be 45 minutes, I promise you. It'll be more like 4 to 5 minutes, closer to that than 45. So this is more like, 10 minutes of wrap up, and then we have a special way to close this meeting. So going forward, a few little changes for us. One of them is, people say, what's in a name? Nothing, but it's everything. So it's been a long time in the making, but where we will be now over during this the academic year, because it takes everything in the university takes roughly 27 times longer than anything else in the private sector, just to get a simple, to change one word, which we're changing one word in our organizational name. Okay, online camp, okay. Sorry. Okay, switching over. So we're changing to the Colorado Consortium for Prescription Drug Misuse Prevention, striking the word abuse. And right. And Jen, God bless her, has been pushing for this for, I don't know, 126 years, so it was true then, and it's truer now. So we're gradually doing this. So you'll start to see a refresh. I wouldn't say a rebranding so much as a refresh in some of our branding, both this name, our website, to make it more user-friendly, I think, and it was built, 13 years ago, 12 years ago, which is great, and it has served its purpose pretty well. But by modern web design standards, it's not very functional or easy to use and all that. So we'll be doing a little refresh of the website as well. And thank you, Lori Westerman, and people here on campus to help us do some of that. So there will be some of those changes coming as well, branding. Our org structure, you heard about the budget changes and things that have affected us. We lost $3.6 million in funding from a $5.2 million budget. So you can do the math. That's the bad news. If there is any good news in it, which there really isn't, but if there is any, the silverish lining, the less bad part was a lot of our money is passed through to go out into communities, right? Like our MAT expansion, where we took about 8% overhead on stuff, when typically overhead rates are 25, 28, 30%. We took 8 to administer a program. So therefore, that 8 is not so much a smaller amount at risk for budget cuts, but still we had to reduce staff from 14.5 FTE to 9.5. So it's a bitter pill to swallow for us. And luckily, in some ways, and you'll hear one of these is we'll talk about the last one at the last, but 2 positions for external relations were unfilled. People had moved on to other things. We were in the process of trying to identify new candidates and rehire them. And in this budget crunch, we just took those positions and put them on the back burner. They're not officially gone, but they're frozen. So we have 2 external relations staff instead of 4. We had eyes on going from 4 to 5 to 6 to 8, but not in the current budget, we don't. So this is important. So we've lost that. And one person, we did have to cut one staff member. So our budget was not getting there without that. So unfortunately, that was Michael Davidson, who many of you worked with for a long time in communications and doing a lot of that stuff. But we have school and campus resources that we're working with, like Lori here, who will more than fill the void. But again, we have to be creative with what's available for us and the supports that are already there within the school, the unit here for us, and the campus level to survive for us. And so it was minimal. It was unfortunately having to let one person go, which I did not like doing. I've never had to do it. To let anybody go my whole career, but had to do one, and it was the minimal amount of damage. But here's what our org structure kind of looks like now. Myself, Jen Place is the assistant director, and we'll talk about the omission up there near the top of that. We'll talk about that in a minute. But our ERS team, Kristen and Eric, still doing a wonderful job. Jessica, Hillary, and Shayna as our program managers, and in support, Rosemarie and Teresa. So this staff, terrific, and we'll continue to plow forward and do a lot of. I always say it's a lot like going back one iteration of where the consortium was. We were kind of consortium 0.1 with just me and Rosemarie and $12 and some rubber bands, and then it was consortium 1.0, 2.0, 3.0, kind of 5, 10, and 14 FTEs. We're taking a step back to our last state, at consortium 2.0 in terms of staff level. But we've been very effective in coordinating things and doing good work even when it was 0.1, and we still did good work, and we will survive and we will thrive with this. And that's where this collaboration means all the more to us, is that you're here, and thank you for staying through it. But you'll see some changes there, and we'll still do a lot of what we've been doing with, developing partnerships at the very top. That's the first thing, is partnering is virtually the single most important thing that we do, and allowing forums for this kind of thing, like the convenings at the bottom. And we see this runs through everything we do, is partnering and convening. And then we do some program work. We administer some programs. We have public awareness, we have some provider education, MOUD expansion. But that's not what we, most of what we do really is facilitation. And then we do some policy work in support of our, legislative stuff. We've had a lot of success in that over the years. So moving onward, how are we going to approach this constrained resources problem? You heard this morning, we follow collective impact, and we use this sort of a strategy framework to say, what are we going to keep doing? What's a critical priority down to? What do we have to pause, and what do we have to sort of say, okay, we can't do everything that we were doing. You don't go from 14.5 FTE to 9.5 and do exactly what you were doing before. Not enough hours in the day. Nobody was sitting around eating bonbons. Maybe I was, but that nobody else but me was sitting around eating bonbons. I was doing that by myself. So pushing forward, we're keeping our current efforts and projects in our key areas of focus, supporting harm reduction efforts and naloxone trainings, keep the party safe, our public awareness campaign, and we're not doing, like we've had that conversation. Don't create 26 more campaigns. Focus on these things, help localize them. We've talked about keep the party safe, and how do we do that with communities? How do we keep leaning in? That message seems to be getting through and being well received. Keep doing it. Do it better, do it more targeted. How do we do that, right? Developing additional provider education. So we hear these topics. What do they need to hear more about? Contingency management. Other kinds of things that we need to hear. We listen, we translate that into provider education and start pushing it out. It's a very gradual process to try to educate all of the providers in Colorado. Good luck, because we have tried, and it virtually can't be done. But we are going to attempt to do it and get every single physician, licensed physician in the state of Colorado, every pharmacist, every nurse, to try to do it. But we're going to keep at it. So it's a large part of our mission. We're at a university, right? We do education. So it's a large part of what we do. Building continuity of care from hospitals and jails. We heard a lot about that already today, and it is a major focus for us going forward. Continuity of care, especially in these transition points that are so important that everybody knows. You can have a wonderful ED induction program, of which there are many, a lot of progress made. And if we fall down getting people, continuity of care into the community, then it's all accounted for naught. So we have to focus on these transitions, and we're going to continue to lean into those transition points in these high-risk areas and high-risk periods in people's lives. Supporting the ROAC work. We've been doing it back to when I know it can be done in 64 counties by one person, because I can see the person over there that used to do it in 64 counties by yourself. Of course, there weren't 19 ROACs at the time, but we still support the regional opioid abatement councils. And how do we do that? Because that's kind of our connectivity work to do that. Assisting community organizations with the acquisition of grant dollars. Our grant writing assistance program was a last-minute addition to a budget several years ago, when it was like, hey, if we have this extra little amount, what would we do with this that would be impactful? Grant writing assistance. And that came from suggestions in these rooms. When the moment presented itself, I just threw that on the table and said, what about that? And that got put in, stuck in there, and we had it. Now this program has been out there for a while, and we spend dollars as fast as they can be appropriated to us, and our ROI is over 50 to 1 on that. It's a no-brainer. And everybody understands that's a good idea to fund this kind of thing. So we're still scanning for funding, asking. We go around and I shake my little cup with the 1 nickel in it, say, well, you need to fund this, because this is super high yield. This will help communities. It has, and it will. So we'll keep doing that. Creating recovery-oriented systems of care, recovery, right? That's what it's all about. All this stuff hopefully leads to recovery. That's where we're at. That's our, for us, it's yes, we want overdose deaths to be less. We want prevention to be better, but it's really everybody deserves and should have a chance at recovery. And then showcasing stories of those with living experience, and still do that. And there's more that we will do, but those are our core things. Really, I'm not going to read all these in detail. You'll have the slides, but to continue to build bridges and support. reaching groups that we haven't engaged traditionally very well with, no matter where they are, and different coalitions, different groups. How do we help, foster those things, bring whatever it is that groups may want or need to the table? Because that's my question in this is, what can we do for you? Not, it's tell me about what you have going on and what can we do to help? And if there's something, then we'll try to do it. That's why this listening at the end, to me, is the most important thing of this meeting. So I hear these 5 or 6 things. I'm like, we're going to do that. We will do that. And you'll see that in the next year, we'll be talking about those things next year because we do listen and we are driven by and moving by. We will flex into what the needs are, and the expressed needs are, you're the folks that are out there with shovels, moving dirt around. You're the ones doing the work. You're the ones with the sore backs at the end of the day doing the work. So we need to listen to that and respect that and help that. So we will. And then, other things, just different examples of them are there. Now I want to end with, as you saw, the organizational chart it had one conspicuous omission. This is because, despite my attempts to delay this even further, been trying for forever to delay it till till whatever, until I'm long gone. Jose Escobar is retiring at the end of December. So it's kind of not a well-kept secret. It's probably one of the worst kept secrets that we've got, but it's something we want to take the last few minutes and really celebrate Jose's career, because it has been, and I'm going to try to do it without choking up. I just tell people I was going to have to try to do a roast and crack jokes, because I'm either going to laugh or I'm going to cry. It's going to be one of the two. Maybe it's going to be both. But Jose has had a 45-year career in this field of SUD prevention, treatment, and recovery. Jose knows everybody. Jose is the best connector you'll ever meet. Jose has worked tirelessly for decades across this space and in this state. And I really don't know if I could find somebody that's had more impact on the field in the state as a single individual than Jose Escobar. And he's been a terrific partner. He's one of the first persons I gravitated towards and latched onto at the AG's task force way back. It was the meth task force, and they needed a pharmacy person to represent the profession of pharmacy because it said so in the statute. So there has to be a pharmacist. I'm like, what the hell? What the heck? And that's why I got into this. Jody Gingrey back in the day came to the pharmacy school and said, we need volunteers for our little task force. Sure, what the heck? Say yes to things, right? And so sat at one of those meetings and met Jose, and in over 20 years of state government service, he has done a lot. I'm not going to read all these things because we'd be here longer than I promised. And Jose doesn't want me to read all of it. But suffice it to say, he has really been instrumental in creating and then building and facilitating so many of these initiatives. The Attorney General's office and the Substance Abuse Training and Response Task Force that you're aware of. It was Jose and John Suthers and starting all of that back to when the consortium started. That was some strategic planning and the AG's office and the governor's office, and gee, we have this thing. And Kelly Perez and Jose and I are standing there in the room, and Kelly said, here, take this strategic plan. I'm like, don't give it to me. Don't give it to me. Yes, give it to me. So, and then Jose and I, we're talking, and this idea hatched, in May of 2013. And since then, he was at the AG's office for a little while longer at that point. And then when there were changes there, I was waiting outside the door, kind of in the bushes there by the center, when Jose came out the door, and grab him before he could get to the car and go take another job. Because Jose could go to a whole lot of places. It's very good, right? But have had the pleasure now of working with Jose here for the last several years in really, making the consortium what it is. And because of that, we want to thank and celebrate Jose with a very special award that I insist that this one be what we're calling the Jody Gingrey Exceptional Service Award, basically for a lifetime of service and achievement. In the name of the person who started this was Jody. And I think it's appropriate that he received that kind of award in recognition of a lifetime of inspiring leadership and impactful service to SUD prevention, treatment, and recovery. So thank you very much, Jose. Thank you.
Well, thank you all very much. And We are going to attempt to have a little bit of a gathering, so we'll invite some other folks as well. Hey, I'm ready. I told folks it's starting to feel real, like in October, because the 31st is coming around the corner. But I'm pretty ready. But I'm feeling really good. This state is amazing. I think just seeing the room filled this morning, and the conference that we had last week with the AG's office with the COAG, all those young folks that are here that are really geared up to want to do this work. It's just amazing to see how many people have compassion for folks who have an addiction. So I'm feeling very hopeful. And I certainly do hope. I think it's been a great partnership. The opportunity to serve in these kind of positions that you see up here to help move some things along, but it couldn't be done without listening to people, to hearing for you all. I know that several of us have had an opportunity to work really closely together, but it really is listening. I'll share with you one story, though, that has stuck with me for years, because I used to be a clinician. So I started my career really young. I was very fortunate that I had some really wonderful mentors. So if you have the opportunity to mentor a young person, please do. But I had an opportunity to be mentored by some really fantastic folks in juvenile justice, counselors, child psychiatrists, got some training at the Department of Psychiatry at University of New Mexico, and did clinician work for about 12 or 13 years before I came into state government. But I'm just going to share one thing with you, because I think it's important for all of us to remember this as well, is that I remember a time I had left New Mexico to go work in Iowa. My wife had gotten into graduate school in Iowa, and I was working with a treatment group doing adolescent treatment work. And this family brought their daughter in. She was 17 years old, and they wanted an assessment. They were worried about her alcohol or drug use. And I remember spending this 45 minutes with this person who really didn't want to divulge a whole lot of information about herself or her drug use. So when the session ended, there wasn't a whole lot I could recommend to the family. Couldn't do a whole lot. Iowa City, anyone familiar with Iowa City? It's a small town, college town. And I would see her when we would go downtown, because that's where a lot of the young people who were just kind of hanging out would hang out. And for about a couple of years, I would see her there, but no interaction. And then about 2 or 3 years later, out of the blue, I get an appointment scheduled with this young lady to come in. So she's now no longer a teenager, she's a young adult. And she came and she had a letter, and it was addressed to me. And basically it was a suicide letter. She was going to commit suicide, but she decided to come in and talk to me. And I have no idea what I did in those 45 minutes I first met her, but whatever it was, and us just kind of seeing each other over the time, she came to the point to make a decision to come in and get help. And she did. And we got her into the adult inpatient unit, and I watched her go through her program. She left the program, went into recovery, and started doing schoolwork in college. And about 2 years later, came back and got a job in the inpatient unit at the front desk. And the next thing you know, this organization had a softball team. Next thing you know, we're playing softball together as colleagues. And I have no idea what I did. I have all this wonderful training that I had, and all I did was spend 15 minutes with somebody in a way that had an impact on their life. And that's what I'm hoping all of you just keep that in mind. There's that possibility that you've interacted with somebody and you don't even know what you've done, but at some point, hopefully it's something that does transform their life. And I'll leave you with that.
So thanks, Jose. And there will be a sort of a retirement open house kind of reception kind of thing. We're looking at maybe the first weekish, 10 days or so of December, looking at a venue, so all that. So we just didn't have it all nailed down. Couldn't give the announcement out right now, but there will be, so you can come, there'll be an open casket and you can give your respects. And so, sorry, Jose, I had to give one, right? Had to make one joke, right? So, and you don't have to be dead to be in a casket. You really don't. You don't. You can do this. There's races in Manitou Springs. You can enter the races, and you can do this. It's possible. So anyway, so I just want to say thanks again, everybody, for coming, devoting another day of your time. I think this is still important. At least I think so. Once a year, come touch the stone again and re-energize ourselves and keep doing this. And it's in some ways it's merely symbolic, but I think it's important that we still do this. And hey, as long as people keep showing up, we're going to keep making a place for people to collaborate and show up, because that's what we do and that's what all of us do. So thank you, and we will see you next year.